Hi everyone, Dr. Nemechek here, and I want to talk about combat PTSD and even other forms of PTSD. It applies, seems to be equally well. We've had, probably 30 men and women with rather severe combat PTSD from a variety of circumstances, and all pretty much the same horrible memories, a lot of emotional dysregulation throughout the day, a lot of triggering from events, noises, objects, horrible nightmares over and over again. These soldiers, combatants, are from the recent Gulf Wars, Vietnam, gentleman from Korean War, and one gentleman actually from World War II. And so we put him on the protocol. And what we see is by around, and they often all have autonomic dysfunction too. They got lightheadedness and brain fog and stuff like that. By around months 6, 7, 8, the triggering stops, the flashback stops, the dreams stop. The memories of these events don't necessarily fade, but the emotional dysregulation fades. And what we believe is happening, that's supported by other evidence, is that when your protocol is designed to suppress this high levels of not only systemic but brain inflammation, and that when those are suppressed, we know that the emotional center of the brain, the limbic system, and the hippocampus can repair themselves. And that I think in some way that these backed up memories are able to be processed, and however the brain puts them into a place that we can live with without this lingering problem. Their autonomic issues recover just as well as anybody else's as well. Now, one case I want to talk about is a gentleman in the Gulf Wars had been in a vehicle where IED had exploded. This is a explosive device that's often hidden in the ground or in a package, in a trash can, in somebody's body. And he was in a vehicle when it went off. Most of the people in the vehicle were okay, beaten up a bit, but he said nobody had died. But after that, and being fearful of that throughout his tour of duty, he could barely drive down the street. Anything, the trash cans, other cars, just anything, little objects, large pickup day, there's junk sitting out there. To his brain, it was being interpreted to be something that could kill him. So he ended up having to live very, very close to work. Otherwise, it was almost impossible to get to work because of the fear. We put him on the protocol. 6, 7 months, completely stops. And his autonomic issues had dramatically improved. And then I remember ironically talking to him. So I think about 2 years later, he had taken leave of work, and he and his wife were now full-time RVing around the country. So here's a guy who couldn't drive a couple blocks to work because every little thing that was on the side of the road would trigger his PTSD, and he recovers so much that he can just drive that RV all over the place with no problems. And so that's the kind of recovery you can see. And I don't pretend to understand it all, but I know it helps. I know it's safe, and if people are on other medications they're needing, what we do doesn't just suddenly replace all that stuff. But what we do find is a lot of it isn't necessary after 6, 12 months. They're able to get off of that. So, the protocol is continuous rifaximin twice a day, fish oil, olive oil, and in this case, we generally need 2 hours of vagus nerve stimulation a day, which we have those type of devices in the office here. And so if you need help, consider just to fly out to Arizona for a trip. And then for 18 months, we could do all your follow-ups by Skype. And usually by 12 months, people don't even need me anymore. and it's just this steady improvement throughout the way. So I hope that's helpful for you all. Thank you for your service. I come from a family with a lot of military people who have served in the military, and I thank you all. Bye.